What are some symptoms and signs that previous gallbladder cancer patients have shown?
Oh, I can answer that one. So sometimes there's nothing. And sometimes it's like a gallbladder attack where you think it's gallbladder stones, and they actually go to the operating room thinking they have gallbladder stones and they find cancer accidentally.
Isn't it like the cancer is really hard to find because it doesn't like cause specific like symptoms and signs
Yeah.
like leukemia? Like you could like tell when you get leukemia, but like if you
That's
have a
right.
stomach ache.
If you have a stomach ache, sometimes people ignore it. You know, they don't pay too much attention to a little stomach ache or some nausea or something like that because it happens. But and then by the time it's becoming a real problem for them, it's already advanced. So yeah.
The second question is, if a family member has gallbladder cancer, are there like other ancestors or family members prone to get it? Like, is it genetic?
Right. So we don't know of a gene that's responsible for it. In some countries, there's things like infections and things like that cause it, and sometimes the whole family might be susceptible to these infections. But in the U.S., it's not. There's no known cause that can be passed on.
Okay. 3 is, what is the life expectancy of someone who has been diagnosed in the early stages?
Well, in the early stages, if it's a really early stage, the hope is that you're going to cure them and they're going to live a normal life. So it depends on how early. The number of people that are found in that early of a stage is very small.
Okay, so question number 4. Ellie, do you want to do that one? Sure. What are the ways that you can treat gallbladder cancer or treating it now?
So we treat it with surgery if we can, if it's really localized. If it's just in the gallbladder, we'll operate on it. If it's spread further than that, sometimes we use radiation, and we frequently use chemotherapy to treat it. So those 3 are treatments of the main treatments.
Okay. Question number 5. How does technology help you to find like new research and like close to getting a cure?
How does technology help you find new research? So one of the things that we're doing with these cancers that are less common, gallbladder cancer is not very common in this country, and we sequence the DNA to try and find mutations that we can possibly target with new drugs. So we're trying to treat it by looking specifically at the mutations within the DNA of each tumor.
Oh, I think I've heard of something, target therapy it's called, and they like can actually find the height and width of the tumor, and so it's like spares the other like healthy tissue.
So that, I think what you're talking about is the radiation. So with the radiation, there are new ways of delivering radiation that can be more specific just to the tumor and spare the normal tissue. So people talk about targeted therapy. There's targeted drugs that target the mutations in the tumor, but then there's also targeted radiation.
Okay. Ellie, do you want to do the next one? Sure. Is there any sort of test you can take if a family member has had the cancer screen for an early detection?
Not really. So it really isn't passed down in families. So if somebody's family member has a gallbladder cancer, you're at no different risk of having a gallbladder cancer. And there's really no good screening test for this.
Why is it so hard to diagnose gallbladder cancer at earlier stages? Which you kind of already answered this one, but
yeah, but we can. So it can be hard because unless they're having pain, it's in there and you don't even know it, because it can grow into the liver and it can spread to other places without ever knowing it's there. It's only when a cancer causes pain or people start losing weight or they have blockage of the bile ducts that it's found, and by that point it can already have grown and spread.
topic are you mainly focusing on to like finding a cure or possible cure?
Well, there's a couple of different ways. One is prevention, to prevent it from occurring. And actually they've shown that in some countries that have a high incidence of gallbladder cancer, people have automatic gallbladder operations and have the gallbladder taken out before it becomes cancerous. And they've shown that they can decrease the rate of gallbladder cancer. But in this country it's so rare that they don't do that.
Kelly, do you want to do the next one?
In your opinion, what treatment plan do you recommend most and why?
Do you want to talk about chemotherapy?
Sure.
Carolyn will answer that one.
So I would say for gallbladder cancer, one of the most common chemotherapy regimens that we give would be, I would say, Folfax.
Or Gemcis.
Yeah.
Are those types of like chemo medicine?
Yes. So both are chemo regimens, so it's a cocktail of several different kinds of chemotherapies attacking the cancer in different ways.
That's cool. And how can treatments such as radiation affect people in their everyday activities?
Well, radiation can cause people to be really tired when people are getting radiation. Depending on what part of the body's being radiated, if they're radiating the area where the gallbladder is, sometimes it can cause some nausea and people lose their appetite because the stomach's right near there and might get a little radiation. So those sorts of problems.
And then the other two questions are on my iPad, which my dad has.
Okay.
But